you then?
Because he's just messing with us. Don't you see? He's got us right where he wants us. We can't go to the police. He's just out there watching us and waiting for us. What are you waiting for, huh? What are you waiting for? What are you waiting for?
What am I?
Yes. So, situation is we have more than 40 COVID-19s in here, Finland, and I am mad at our own health information provider. It says here 40. Near my place is 2, and okay, I'm lucky about that news. Few days ago, they had this news in Twitter that if you have came from Italy, there's no reason to stop you to see your elderly, and that's crazy talk. That's crazy talk. But I am happy they have now published here that if you have any symptoms, don't go to see your grandmas and such. And then these people are claiming that this COVID-19 does not spread for surfaces, but as the Gottlieb here says,
people need to be more aware of being in crowded environments. And on an airplane, it's not the air quality that worries me. I don't think this spreads easily through the air on an airplane. I think it's more of the touching of the surfaces and the unclean surfaces and passing things back and forth between passengers, which Starbucks did to stop refilling cups that people bring in for their own coffee, the barrister. That's brilliant, because what would happen is someone would bring in their dirty cup if they maybe had coronavirus, give it to the barrister would touch the cup and then touch the next 30 cups. If all businesses thought about steps like that, simple things that they can do to reduce transmission, we could really have an impact on this. But we need leadership. We need to be talking about these things in a systematic fashion. We also need a systematic approach to when localities close schools, close businesses, cancel large events. We need to be all working off the same kind of playbook.
Yep, and it's just said here some news that this our health information provider does not see it necessary to rethink all these large group gatherings. They say it's not necessary that effective, but other countries are canceling their large groups gatherings.
This is an issue for everyone. Now, I've been a little harsh on governments, maybe. Well, not harsh enough, probably, but I've mentioned governments and the lack of what I see as the lack of response, or the low level of response, lower than I would like to see.
Yep.
But this is for us as individuals as well. So if you've come back from Italy, self-isolate for 2 weeks if you're in my country, please.
Do so.
This is not just about you, it's about your family, it's about your colleagues, it's about your workmates, it's about me, it's about everyone. We have to work together collectively. So it's for individuals as well as governments. And if I can just paraphrase what a great man of the past said, healthcare must be of the people, by the people, for the people.
True that. Almost all these 40 cases we have here in Finland, COVID-19s, are from North Italy. So if you come from Italy, please self-isolate because of those who cannot, for those that has no that great immunity. So here's this person name was Caroline Chen, and I really like her way to present things, and this is about the information and education, if I remember right. No, this is
time. So I think what's really important to know is that this is more deadly than the flu.
Sure.
And in particular, there's enough data right now to know that it is a really dangerous disease, particularly for the elderly. That's important to know. I think scientists are also confident enough to say that it is less deadly than a disease like SARS, where the fatality rate ended up being in the ballpark of 9 to 10%.
Right. So regardless,
So we know that.
So regardless of whether it's
Yeah.
2 or 3%, that doesn't mean stop washing your hands and now everything's fine because it's 2, right? We still have to be much
It's a dangerous disease and it needs to be taken seriously. But I think that freaking out over 2% versus 3%,
Yeah.
I think that's not very helpful right now. And I don't think it really makes a difference to the public, whether, those two numbers, what's the difference? I don't think we have any actionable steps we can take between that sort of percentage change.
Well, what about the notion of what is essential and what is non-essential travel and how different governments around the world are reacting to this? I mean, in a way, China had...
great information, but 12.
play out the same way.
Right, and this is what I was just talking about, which is everybody doing their part to have good personal hygiene habits, stay home if you're sick. And we should probably talk about this, which is, what are the symptoms of COVID-19? And the first presenting symptoms in most cases are fever and a cough, not a runny nose. I don't know how many people know that. And then what should you do if you do feel sick? We don't want everyone to rush to the ER. That would overburden the healthcare system and probably increase spread. So the recommendation right now is to make a call your doctor, call your provider. If you're feeling really sick, call 911 if you need to, but it's pick up the phone first.
Yeah, that's true. So that's that. I put all these links down this video's description. You should search the information for yourself. As it seems, the news sources necessarily does not give you the correct information. And I have normally trusted our healthcare system here in Finland, but at the moment I don't trust the level they have there regarding of this COVID-19. Here. Speaking of healthcare workers.
But healthcare workers are a global resource. Healthcare workers are a precious resource, and the life of a health worker in one country is certainly as valued as the life of a health worker in another. So we would like to see that word again, solidarity, distribution of whatever the commodity is, on the basis of need, on the basis of benefit. And when we look at that, our most exposed workers in the world right now to this virus are frontline health workers. And anything that blocks them getting the help they need, getting the assistance and protection they need, is not good. So we do call on countries to re-examine their decisions to requisition and try and ensure that essential supplies of PPE are made available to health workers around the world.
Yes. And if I remember right, the same subject in 126. Let's start here.
Goggles fog up, your hands just become totally unmanageable. It's very difficult. And you've seen those workers in China having to do 8-hour shifts without even being able to go to the toilet because they couldn't, they had to work 8-hour shifts straight through. So I think in those circumstances we owe a lot to those workers. The very minimum we can give those frontline workers is the PPE and the training. And the management arrangements so we can manage their stress and their fatigue. And I think most countries are moving to do that, and that's why we spoke earlier about this issue of requisitioning of PPE. The real tragedy, I think, in the coming days and weeks will be the moral hazard and the dilemma that health workers may face if they've got COVID-19 patients in front of them who need help and they don't have the protective equipment to protect themselves. Would you like to be that health worker? Would you like to be a doctor or a nurse, having to treat a patient, knowing full well that you are not protected? That's an awful dilemma that no health worker in the world should have to face. And it's a massive responsibility of government at national level and at international level to have the solidarity to fix that. But having the equipment doesn't solve the problem. You also need training. And training is just as important as PPE. And Maria might want to comment on that. We have a lot of training material online, and there's a lot of support for countries to do training.
Yep, and there are so much very good information. 130 was a question about at what point of story we are with this COVID-19. Well, let's start there.
Thank you, Jim, for that.
Maria may want to give a more technical answer than me, but right now I think we're still very much in the beginning or middle, at the very maximum of this fight. The disease has not run its course by any means in most countries. In fact, most of the countries affected of the 100 have recently imported the disease. The spread of the virus now and its impact are more in the hands of us and society than they are due to the virus itself. There's a lot, and Maria has spoken to this, the DG has spoken to this, there's a lot we can do to slow it down, there's a lot we can do to turn this virus around. And there are things that may happen with temperature change. Not that the virus will change because of the temperature, but certainly human behaviour changes according to seasons, and the way in which humans mix and distance socially changes with seasons. So we may see some natural changes in the incidence of the disease. But as I've said many times in the past, hope is not a strategy, and therefore when we look at this as being realistic, we're still very much in the up cycle of this epidemic, and there is still a number of miles to go. The hope, and to be quite frank, the way in which China, Singapore, Korea and Japan are at various points of turning a corner gives me great hope. And in that sense, and as the Director General has spoken about, the very fact that there's an element of controllability, there's an element that this can be turned around, and we need to seize that opportunity. In that sense, the Director General has been talking about the window of opportunity closing and the spectre of a pandemic rising. Well, at the same time, another window of opportunity may be opening, and that is the data and the experience in some Asian countries where there's clearly an indication that the application of measures across all of society, a systematic government-led approach using all tactics and all elements available, seems to be able to turn this disease around. Maria, you may have a more precise definition.
Yep, and then there was this the social distancing is from WHO to all countries. Though the Finnish health organization, we have given our information to health workers, they are saying it's not necessary, but WHO is recommending social distancing, but you may hear it yourself when I search the point in one 145. Maybe that's enough.
All of them, actually, the fundamental principles apply to all countries. And I have tried to outline them. And one of them is what you just said. I started with emergency response mechanisms, risk communications and public engagement, case finding and contact tracing, then public health measures such as hand hygiene and social distancing. But the social distancing is not just for the elderly only, it's for the others too. So where we should apply, especially in countries where we have community transmission, then it has to apply to all. So it will not be just for the elderly only. So we need...
Yes. So all this information, there are a lot more of that. I'm not too happy to where these things are growing at the moment. So most of these recent news are about we have 40 cases and several places are in to be quarantined. Several people and several schools and daycare and then there are these news about persons that has been they have victory from the illness and after that they have new case in their body. Oh, I will not read all those not so nice news. Also, these are almost 99% of cases are from Italy. Mainly from North Italy. And those informations has not changed. It's 40, 261, 227. As I heard, perhaps correct, the WHO is at that point where they say this is pandemic. So couple of days ago that country's number was 109 and now it's 115. Take care. If you have came from Italy, please self-isolate yourself, and if you have symptoms of flu, common cold or such, or ill, whatever the reason, self-isolate yourself and perhaps use mask at that case if you feel somewhat ill, and wash your hands and eat C vitamin, the recommended dosage, and D vitamin, and don't hug, don't kiss, don't keep the distance, and use the phone. Most of us have the video opportunity in our phones to call. Use that. And if you want to socialize, I don't want to. And search the information. If you are an adult and you have internet, I suppose you have if you hear this. Search the information for yourself from internet, collect from many places, and from many places you find what is the truth. If you are an adult, you find the truth there. Take care. Let's love ourselves from distance to be a better place to live. Bye.